Hello, everyone. I'm Saleha, and this is Chai, Chat, and Community. Tonight, we are discussing the dreaded M word for many of us women who are 50 plus. We're talking menopause, and to understand what menopause means and what you can look forward to or not look forward to in the coming months, I am joined by the gorgeous Dr. Nisha Khot, who is a regular and is always ready to come and chat to all of you, and Dr. Latika Cilly. Thank you, ladies. But before I start, I would like to begin by acknowledging the traditional owners and custodians of the land on which we meet tonight. I also pay my respects to their elders, past, present, and emerging. Thank you. Hi, Nisha. Hi, Latika. And thank you once again for
Hi,
Hi,
being
Saleha.
Salika.
invited. Um, Latika, because this is your first time, let's put you on the spot. And do you want to tell us something about yourself?
So I'm actually an obstetrician and gynecologist. I mainly practice in Melbourne's west and northern suburbs. So I have my clinics in Sunbury, Melton, and Werribee. And I have been doing this for last 15 years, and absolutely love every single part of this job. Um, the people, the babies, everything.
Thank you. Nisha, for those who do not know about you,
I am an obstetrician and gynecologist, also mostly in the western suburbs of Melbourne, but I also work at the Royal Women's Hospital in the middle of Melbourne. And yes, just like Latika, I've been doing it for a few years now, and I love everything about it. That's why we're still here, despite the fact that there are many nights when we don't get any sleep.
I'm sure. So before we start, I'm going to just acknowledge Neha. Neha, thank you for joining and watching. Neha runs a mums group of 10,000 plus ladies.
Wow.
Welcome, Neha.
Latika, we start with you. What
Sure.
is menopause and what are the typical symptoms?
So menopause is actually a clinical diagnosis, Saleha. So usually when I see my patients, many of them ask me this question. It is always a retrospective thing. So we go back and say, okay, menopause happened last year. So if you don't have any bleeding whatsoever for a good continuous 12 months, that is when we say you have gone through menopause. Now, absence of bleeding is menopause, but it has to be a consecutive 12 months. If it happens to be 6 months, if it happens to be 8 months, if it happens to be 10 months, that cannot be called as menopause. So the clock restarts from the month that you have had the bleeding, and we count 12 months again. So mainly the symptoms of menopause. Now, some people cruise through menopause. They have absolutely no symptoms. 1 month they were having a period, next moment they aren't having the periods, and they're like, oh, done, dusted. Great. That's perfect. That's what everybody wants. But that is not the majority of the cases. Many women will have some symptoms to indicate that they are going through menopause. Now, those symptoms can be like the usual that we hear from all our friends, or hot flushes, duna on, duna off, can't sleep, sweats, all of those,
Mood
what we
swings?
term it, yeah, what we
Um,
term as
yes, my daughter stopped
vasomotor
talking about
symptoms.
it.
Yes, yes. So most and sleep is one of the very common symptom that people say I'm unable to sleep, and that affects the quality of life. But there are also other symptoms which you may not be talking to your friends or family, like vaginal dryness being one of the most commonest, or pain during sex. They think it's part of getting old, and okay, it's going to happen, but these are also considered as symptoms of menopause.
Thank you. I have Josna watching, so and Josna, as you know, Nisha is a big fan of yours, so here she is. And yes, no periods for a continuous 12-month time frame It is menopause fact, Dr. Latika. Yes. Um, so, Nisha, what is perimenopausal period and what should women look out for? So, I'm going to just here also ask about Latika talked about, you can have periods 1 month, stop for another, and then start again for 6 months. So, is that normal or is
That
that perimenopausal?
that is very typical of perimenopause. And so generally we say that the average age of menopause is around 51 or 52 years of age. And so most women will find that their periods start to become irregular at around that stage. And it might happen earlier for some women, it might happen later for some women, but that irregularity of periods, but not quite disappearance for 12 months, is really the perimenopause. And a lot of women will start getting all of those symptoms that Latika has described during that perimenopause. And so that then is a time to have the discussion about what we should do about it. Age is a really important thing in this, because if you actually stop having your periods at a younger age, then that is considered to be premature menopause or early menopause. So if you actually stop having your periods at the age of 45, that is early menopause. And if you stop having your periods at the age of 40 or even earlier than that, then that is premature menopause. And that is a whole different situation. So these women will stop having their periods and may also have all of the symptoms that Latika has described, but at a much earlier age. And one of the things to kind of think about is that our menopause or our age at menopause is usually determined by history of how our mothers went. So if our mothers had a slightly early menopause, we'll probably have a slightly early menopause. If they had a later one, we'll probably have a later one as well. And so if you get to the point and you think, oh my God, I have, got to 51 and I can't see any signs of menopause yet, talk to mom if you can and ask her when she got to menopause. And that will probably explain why you are not there as yet.
Okay.
And it
Uh,
also is probably a good thing, I think, if you haven't been there yet.
yeah, I don't know what is good, having regular periods or not having them at all. So, uh, Nisha, is it common? Is it common to have menopause and then you have some incident and then you start bleeding again? Say you haven't, you stopped and menopause is set in, and I ask because I suddenly remembered when you were talking that something happened to my mom. I don't really remember, but she'd already been through menopause, and then suddenly 2 or 3 years later she just started bleeding, and it wasn't like a lot, but it was like for 3 4 days, and it must have been a big incident. I just don't remember that incident, but
Definitely. If you have had a period of 12 months where you have not had any bleeding at all, and then you start to bleed again, that is definitely something that you should see your doctor for. Your GP would be the first person to see, because bleeding after 12 months of stopping periods completely is not normal. It definitely needs some investigation to find out what's going on, why are you bleeding, where is the bleeding coming from, and do we need to do anything more about it? So it shouldn't be ignored.
and is perimenopause what's it called? um Sorry, what was the word? I'm forgetting. The premature menopause, is that common?
Premature menopause can is not very common, fortunately. It tends to occur in women usually who have some sort of background condition, and that is sometimes a genetic condition, sometimes it's an autoimmune condition. So if somebody does get to that point where they're not having periods and they're 40 or younger, that definitely needs further investigation to find out the cause for it. Because one, to obviously treat the symptoms that they have, and two, also that those hormones that we have while we still have our periods are really important for our health. And so from the health perspective, this person who has reached menopause, say at 40 years, should have had 10 more years of those normal hormones. And so it's important that we have the discussion and make sure that they get these hormones, because they're really important for health.
Thank you.
And another common reason for having a premature menopause would be if somebody has had treatment for cancer. So chemotherapy and
Oh,
radiotherapy also can lead to premature menopause depending upon what cancer was treated.
so any kind of cancer?
So basically, yeah, any kind of cancer. So radiotherapy and chemotherapy have an adverse effect on ovaries, so that could possibly lead to premature menopause.
Okay, thank you. Josna's on a roll, so okay. Yes, she's just reiterating what you're saying.
Yes.
Um, don't ignore any bleeding after 12 months of stop periods. Seek medical advice. And we just talked about, is there an age for menopause? So it can be 50 and over, like you said, or early ones if you are premenopausal. Latika, anything else you want to add?
At the same time, we also have to be conscious of the fact of something called as delayed menopause. So if you haven't stopped having periods up until 55, as I was saying, yes, it's a good thing that you still have your ovaries functioning, but after 55, having ovarian function is also something that needs to be investigated as to why. Yes, it could be genetic. Yes, it could be because that's how our genes work, and that's how mom didn't have a menopause till say 57. But the more your ovaries are working, the more risk it can be associated with. So it is also a symptom that needs investigation as to why you are having your periods even after 55.
So menopause age is genetic. So mothers, grandmothers, and before that, or is it just mother, or you don't go beyond?
Usually it's mother.
Usually it's mother, because I remember my nanny did not have I think she was a widow at 32, and I think she got her menopause when she was in her 40s. So that's why I asked. Yep. um so let's talk about hysterectomy, Nisha. This is something that I would be very, very keen on knowing.
So, when somebody has a hysterectomy, it's really important to think about what are the organs that have been removed. So, for some women, it will be removal of just the uterus. For some, it will be removal of the uterus along with the bit of the neck of the uterus that sits below it. And for some, it will be removal of the uterus and the neck of the uterus along with both the ovaries and both the tubes. Now, if obviously you have the ovaries removed at surgery, then that's going to cause menopause because the ovaries are the ones that are producing the hormones. And once they're gone, you're going to be menopausal. If you have only your uterus removed and the ovaries are left behind, then you still have your ovaries producing the hormones. So you won't get a period, but you'll still have the hormones in your body. So you don't get symptoms of menopause straight away because your ovaries are still there. But the fact that your uterus is missing means that your ovaries don't work as well and for as long. And so, if you say have a hysterectomy at 45 and you would normally have had your menopause maybe at 52, your ovaries may not work for 7 years beyond the removal of your uterus. They might only work for 3 or 4 years, and then you start getting symptoms like Latika described. And so, it's important if you are advised to have a hysterectomy to check with your doctor what kind of hysterectomy you're having. Check with them why they want to either leave the ovaries behind or take the ovaries out, and what the advantages and disadvantages of both are. And these days, you also could be having something that's called a mini hysterectomy or a hysterectomy day hysterectomy, things like that, which is not really a hysterectomy. What happens there is that we destroy just the lining that is inside the uterus because the lining is what causes bleeding. And so, for women who have heavy periods, we can do a procedure which just destroys the lining of the uterus so they don't have heavy periods. In that
Is that
situation,
safe? Is that
it
safe?
is very safe. It's very safe. And in fact, it is very quick. So it avoids having that major hysterectomy kind of surgery. So for these women, actually, they have their uterus, they have their ovaries. So their ovaries will continue to work as they would normally work. They will get to menopause at the normal time of menopause. And because they have a uterus, they might still have some bleeding. They might not be completely period free. They might have some bleeding. So it's important to have that discussion with the doctor when you have those treatments to talk about what might happen in terms of menopausal symptoms, whether your ovaries are going to work or not, and what sort of bleeding to expect.
Okay.
And
And
and also
sorry.
there, I think we just have to add there that what Disha just said about burning the lining of the uterus is we sh the patient shouldn't think of it as a hysterectomy, because if in the future for any reason, for her menopausal symptoms, if she decides to go on hormone replacement, she still has her uterus, which I think we'll cover a little bit later. But it is important to know whether you have the uterus or not, because that changes the whole ball game. Now, with leaving the ovaries behind, one fact that we have to understand is in those patients, we won't be able to actually decide when they have gone through menopause, because the definition of menopause depends upon absence of periods, which these patients will already have, because they don't have a uterus. So for them, we cannot go by the clinical definition of menopause. So that that in them, the treatment will depend upon, or rather the decision to treat or not treat will depend upon the severity of the symptoms, not really whether they have gone through menopause or not gone through menopause.
Okay. So, are there any other women specific, uh, uh, let's call it disease for want of a better word, that can affect menopause? What happens if you have fibroids? Will that affect will that affect you anyway? Because I mean, I'm suddenly, and this is going back 10, 12 years. I've been hearing a lot of women uh, going through fibroids and they're removing everything. So does that affect menopause or?
So any condition which causes symptoms, Saleh, so like it's not the disease per se. So, like you said, fibroids, for example. Now, most of the patients who are suffering from fibroids are nothing but little lumps in the uterus wall. In 99% of the cases, they are benign. So, we don't consider cancer as one of the possibilities in these. So, most of the patients do have some sort of treatment for fibroids, and that is mainly because of the amount of blood that they're losing every month. So, these patients bleed a lot, and they end up having a hysterectomy earlier than their menopause. Now, 10 years ago, if you were having a hysterectomy for fibroids, the doctors might have suggested, oh, you know what, remove the ovaries, that's absolutely fine. That was the thinking at that stage. But as we have grown and matured and learned a bit more about women's health, we now realize that removing the ovaries before menopause for a benign condition is actually more detrimental to a woman's health than conserving them for the fear of ovarian cancer in the future. So many of the patients who are having a hysterectomy will say to the doctor, "Oh, why not remove the ovaries? I don't want to have ovarian cancer in
Yep.
the future." The risk of ovarian cancer in general population is actually less than 1%. So it's very, very low. The advantages of conserving ovaries is very high if you haven't gone through menopause. So when we say menopause, we actually take an age of 60. We don't say, okay, 52, 53, if you're having a hysterectomy for a benign reason, let's get rid of the ovaries, because
Yep.
ovaries still are known to function right up until the age of 60. So after 60, yes, but before 60, we try to conserve the ovaries. Now, to answer the question, in terms of diseases that may affect menopause, not particularly of the uterus per se, but there are other diseases which may affect menopause, like, if you have a thyroid issue, or if you have any autoimmune conditions, or any other medical comorbidities that may or may not affect menopause usually. But there are no particular reasons from the uterus itself that would cause any change in your age of menopause.
Okay, thank you. Nisha, how would you define comorbidities for our audience? And I can see many of them are watching. So, what kind
So,
of comorbidities can women expect to have?
So the most common comorbidities, especially, and the three of us can speak to it from the subcontinental community point of view, would be diabetes, hypertension, and weight issues. That is the trifecta that affects us most commonly, and those are the ones that can sometimes affect menopause, age of menopause, and how you cope with menopause, and also how we treat your symptoms of menopause. But of course, there are a whole lot of other comorbidities. Thyroid is the one that Latika has touched upon, but you may have autoimmune disorders, you may have arthritis, you may have other issues as well. But the top three that I would say would be diabetes, hypertension, and weight issues.
Is hypertension common amongst us?
Yes.
Okay. Josna is here, so I will just show the comment. What is PCOS? Sorry, I.
So PCOS is polycystic ovarian syndrome.
Okay. So,
So there are two different conditions, Jyotsna. So polycystic ovarian syndrome in itself increases your risk of having diabetes in later half of your life. It also increases your risk of uterine cancer in later half of your life. Um, Polycystic ovaries does not. So when patients who suffer from polycystic ovaries enter menopause, their menopause shouldn't be any different from people who have normal ovarian function throughout their life, because menopause stays the same. Menopause is basically declining ovarian function, whether you had polycystic ovaries or not. That wouldn't change anything in terms of your symptoms per se. So it doesn't mean that if you have polycystic ovaries, when you go through menopause, you'll have more facial hair and more, weight gain or anything of that sort. It will be similar to anybody else. But overall, patients who suffer from polycystic ovaries generally have difficulty losing weight even before menopause. So they may be overweight even before menopause has happened. They may have facial hair even before menopause has happened. So that might be an ongoing problem rather than menopause being different in these women. I think that's what I'm trying to say. Do you agree, Nisha?
Yes. So, the problem is that if somebody has polycystic ovarian syndrome, they have already struggled with body hair and facial hair and weight. And menopause by itself is a condition where weight and body hair and facial hair becomes an issue. So, put the two
really?
together,
Okay.
and that might be something that happens irrespective of whether you have polycystic ovarian syndrome or not.
Yeah.
Okay. Another question. Josna did warn me that she's full of questions. So here you go, Nisha. Okay. All right. She's just. Yes, thanks, Joe. Um, so, Latika, what kind of help is available for women going through mood swings, hot flushes, and many other unbearable symptoms? I think this my girls need to watch.
Um, so this is a very, very good question, Saleha, and that is, I think, the whole point of having this discussion. Um, there is a lot of hesitancy when it comes to taking treatment or help for menopause.
Yep.
There has been a lot of fear, really, that it causes issues, it causes problems. If you treat menopause, it is going to increase your risk of breast cancer, for example. Um, but it's a myth, really. It's a very, very safe treatment. Yes, there are indications, and then there are contraindications. There are patients where we would say, okay, HRT is probably not for you. So when we say symptoms that you have described for menopause, the most effective and quickest way to treat this is giving hormone replacement therapy. The body is lacking hormones. You give body the hormones, body is happy. Okay, but it's not as simple as that in some cases. So we can give HRT to most of our population, but there are certain prerequisites to prescribing HRT. The most important prerequisite is that the symptoms should be affecting the woman to such an extent that she's unable, that's affecting her quality of life. She's unable to go through her day to day activities. If that is the case, then yes, she is a candidate who should seek help. The other thing that your doctor would want to know is your medical conditions, that you don't have any past history of say DVT, for example, which is a clot in your legs,
Is
ever
that
in your life,
normal?
because no, it's not normal. So clot in your legs or lungs, that is DVT or pulmonary embolus, is actually one of the contraindications of HRT. So they would want to know a bit more about your medical history. So they will check your blood pressure, make sure that you're up to date with your breast screening, with your cervical screening, and they will also inquire about your family history, to know whether there's any high risk factors in family history, like family history of breast cancer might be a relative contraindication, but you still can prescribe HRT because it's not personal history. Coming to the actual treatment itself, it's hormone replacement. So basically, we can give the body the hormones in different forms, in the form of tablets, in the form of patches, in the form of gels. This treatment can be easily prescribed. Some of the GPs in the community can do it. If they are not comfortable prescribing HRT, they might refer you to a specialist for the same. So the
So you
specialist
can't buy
might
it over
be,
the counter.
no, you can't.
Okay.
So when you go to a chemist, there are many over-the-counter medications
Yes, I've
that
seen
might
them.
say that
Yeah.
will help with, yeah, but they are not really evidence-based. And we also get many patients who come to us and say, oh, can I try this? Can I try that? But we always, we listen to them, but we also say that many of these treatments or most of these treatments are actually not evidence based, they are not researched. And what we are prescribing is evidence based. We know what the effects are, we also know what the side effects are, we also know how to monitor it, and that makes it safer. When we prescribe HRT for menopause, we monitor the symptoms. So it's a prospective monitoring of symptoms. It's not so if we prescribe the tablets or the patches for anybody, we revisit the situation in 3 months' time to see how they have responded or whether they have responded. So if they haven't responded to the HRT, then we probably should also be starting to think, are the symptoms really just because of menopause or is there something else? Simultaneously, when we talk about HRT, as we said, premature menopause, that is a different sort of treatment compared to a standard. Although the symptoms are same, these patients who have entered into menopause earlier, they may have to have slightly different treatment than the standard HRT that we give to women who are over 50. In terms of HRT per se, we there's no golden rule per se. We try and give the HRT. The only rule that we follow is the least amount and the most effective. This might be different for different patients. Some may need a slightly lower dose, so we start with the lowest and slightly, modulate it depending upon when she says, "Yes, I'm feeling normal." That's our
So,
aim.
okay. So, other than mood swings and sweats, what are the symptoms? And I have a question here for Nisha, but I'll come to that in a bit. Latika, I know mood swings, I know sweats. What else? What are common and what are not so common? The uncommon symptoms.
So the common symptoms along with mood swings and sweats is hot flushes. You might have heard people say they go really
Yep.
red and they go,
Red. Yep.
I need to fan myself, and they
Yep.
kind of go look at their friends in the room and go, is anybody else really hot here? And they have,
Yep.
it sometimes goes to such an extreme that the patients will say, I carry a change of clothes with me all the time, because
Really?
yeah,
Wow.
that's how hot they get. If that's the case, they are really suffering. So that's one of the symptoms. Really, insomnia is one of the symptoms. Inability to sleep. That's, I wake up in the night and then I cannot go back to sleep. I'm awake for, 2, 3 hours. And by the time I go back to sleep, it's time to wake up again. And that makes them tired during the day. So they are sleepy and tired during the day. That's another symptom. Um, they also complain very commonly when they are seeing a specialist. If now these are the symptoms that if you ask them, they will bring forth this information. Vaginal dryness. So if you ask them, Do you have any other issues? So they might mention that, or you might specifically directed, it's a directed question, do you have vaginal dryness? That is another symptom. Um, Sex can actually become painful with menopause because of the lack of estrogen. And some patients may have noticed that it is associated with a slight, sometimes reddish or brownish discolored discharge as well, which they might mention when you ask pointed questions. But yeah, these are usually the commonest symptoms.
I used to cry. I would just cry at the drop of a hat for no reason. And but
And that is also true that your emotions are all over.
Yes.
You feel like you're on a roller coaster
roller
of
coaster. Yeah,
emotions.
that's exactly what I went through. It was crazy. I mean, for no reason, I'd be talking to my mother and I would just start crying. And then mood swings, yes. But
And some
Nisha,
women describe getting really irritable.
yep.
They become short tempered, they become irritable. Things that they would normally not lose their temper with, they suddenly, there's this screaming, shouting going on in the house because it's just that roller coaster of emotions. That's it.
And the other commonest is I feel like I want to kill my husband.
Oh, that without menopause also. That is without menopause also. That's from the time I wake up till the time I go to bed. That's the one common thing that does not change. Okay. uh, Nisha, one for you here. At what age do we get facial hair? Meena, thank you for watching.
Facial hair is a very difficult thing to answer because each of us will get facial hair based on genetics, first of all. So, some of us will get facial hair when we get to puberty because that is the genetic time when we would develop facial hair. And then, specifically for women who have conditions like polycystic ovarian disease, they will develop facial hair at puberty and that will continue throughout their lifetime. But yes, the development of facial hair associated with menopause usually doesn't happen at that age when you go through menopause, not in those 50s. It generally tends to happen a bit later. So, sort
Yeah.
of 10 years down the track.
I'm suddenly not feeling very good because thanks to the lockdown, I've decided to go gray because I don't have an option. Now, if I have facial hair, that's a bit scary. But
It may
um,
not happen at all. That's also one of the
thank you. That's
possibilities.
what I will hope for and pray for. Um, I'll let any of your ladies take this up. This is Josna. Soy is often recommended to women during this phase. However, it is not common in our diet. What are your thoughts? Why would anybody want to have soy? But anyway, that's my take.
So there's a lot of information that soy contains natural estrogens. And that is why it helps with menopause or menopausal symptoms because you get natural estrogen through soy.
Yeah.
Now, it's not supported by any research or evidence. Lots of people who have soy regularly in their diet still get menopausal symptoms, and some people who don't have soy don't get any symptoms. So there isn't the evidence behind it yet. There may be in the future, we don't know, but currently there doesn't seem to be any evidence for it. Look, soy is good for health, so if people want to include it in their diet, by all means do it, but don't be expecting it to help with symptoms. And especially if it doesn't help with symptoms, get help for your symptoms.
Latika, you want to say something?
No, I agree with Nisha. There are very few non-pharmaceutical things which are evidence-based to help with menopause. Soy is currently not one of those non-pharmaceutical things. So don't, I mean, if you don't like soy, don't torture yourself. I would just say that. If you
Okay.
like it, that's fine, but if you don't, that's really not the treatment. No.
Okay. Um, so, Nisha, if someone doesn't want to take HRT, what other options do they have?
So there are a few other medications, drugs that you can use, especially if you have very specific symptoms. If your symptoms are basically to do with hot flushes, then there are other drugs that can help. One of the commonest ones is an antidepressant. So, and sometimes, when you start talking to
Really?
women about using an antidepressant for menopause, they get, oh my God, I'm not depressed. I don't need an antidepressant. But actually, that antidepressant works really well for the symptoms of hot flushes. And so that might be something worth trying. There's also an anti-epileptic medication that seems to work well. It's used commonly for chronic pain conditions as well, in addition to epilepsy, and that can sometimes work. And something called Clonidine, which is originally a drug that was used for high blood pressure, but that also seems to work well for women who have mild symptoms, especially the hot flushes. So those are the alternative kind of medications that don't have hormones in them. And especially if your main symptom is hot flushes, then they can help with that. Other than drugs, there are actually a few things that do help. And those are things like regular exercise, yoga, meditation, mindfulness. Now, I'm always very reluctant to bring these up because for a woman who's having hot flushes, I don't want to tell her, go try yoga, because yoga will not help you with your hot flushes. And women get this message all the time. Every time we bring up any issue, we are told diet, lifestyle, yoga, mindfulness. And, my eyes start to roll if somebody says that to me. For somebody who has symptoms, they need help with their symptoms. All of the other things are great. They will be helpful in the long run. They are good for your health. They are good for you to get out of that mindset, which you can sometimes get into, that negative mindset of, oh gosh, now I'm menopausal, I'm useless to the world. All of those are really helpful to get out of there. But if you have symptoms, then there are drugs available and we shouldn't be reluctant to use them.
Okay, and are these drugs lifelong, or can you stop it after say 1 year, 2 years, whether it's HRT or the alternative drugs?
So, Saleha, with HRT, there is a limitation. So the guidelines currently tell us that you can take it for 5 consecutive years or up until the age of 60, whichever comes first. After that, it is advisable to discontinue the HRT because the advantages are nullified after that. When we say advantages, what are the advantages? I mean, it will still give you symptom relief. It will still, prevent hot flushes and all of your symptoms. But HRT also, in a way, protects your heart, protects your brain, protects your bones. So all of these symptoms or all of these advantages are nullified after the use of HRT for 5 years, and it kind of becomes the same as any other person who is of the same age. So after 60, we say it doesn't protect your heart anymore. It doesn't protect your brain anymore. You are at increased risk of a cardiovascular event or stroke. So we say you have to discontinue HRT after that time. Now, that is the biggest problem with HRT. It's not cancer. The biggest problem is discontinuing it because the women feel normal while they are on HRT, no matter when they stop it, whether it is 3 years, 5 years, 10 years, the symptoms are going to come back. So
Will
you
they?
will,
You mean
yes,
hot flushes and everything?
yes, so you will have hot flushes again, you will have night sweats. They will not be of the same intensity as it was when they first started. So when you first went to your doctor to say, I think I am dying, I want to feel normal again, that effect or that severity won't be there, but it will happen. So you have to warn your patients even before you start the treatment saying, yes, this will give you relief, but we have 5 years now to get you to a stage where you are not going to be dependent on this. And that's where yoga, meditation, cognitive therapy helps a lot because this is all proven. So we have to discontinue HRT at some stage. So that stage is 5 years or 60 years of age. In
But
terms of non hormonal medication, I think there is no particular guidance as to how many years you can take the antidepressants, but as I said, it all depends upon your severity of symptoms. So, supposing you are somebody who is contraindicated for HRT or couldn't take HRT and was started on an antidepressant which helped with your hot flashes, but simultaneously you started doing the alternative therapies like yoga, meditation, and cognitive therapy over years, over a, it, and it is very individualized. It will change, it will be different for every person. So for some people it will be a year, some people it will be 2 years, some people it will be 5 years, but after that you will feel that you no longer need the tablets to control your symptoms, and at that stage you can discontinue,
But
obviously with the help of your doctors.
so, Nisha, when do these hot flushes totally stop? If you were on medication, do they stop after 5 years? It comes back, maybe not as severe as what it used to be, but does it ultimately just slow down and go away? Does
Yes,
it take a
yes.
really long time?
And there is light at the end of the menopause tunnel. It
The
does
tunnel can be
eventually
10
stop.
years, and that's a very long, very long tunnel for me then. Not that I am on, I haven't taken HRT, but I'm just thinking of a friend who does. So I don't know whether she knows that she has to stop it, because we haven't talked about that yet, and not that. And then does she come back to all the sweats and everything else?
So with
And
And how
whenever
that
long?
is
some
And that is why
so
what Latika said was very important, that when we have that first discussion about starting HRT, and yes, absolutely, women should have help and should have HRT, but that conversation about what happens at the end of 2 years, 3 years, 5 years, what happens when we stop, why do we stop, is an equally important conversation to have.
And anybody who is on HRT, Saleha, so whenever we start HRT, we recommend an annual review of this patient. So every 12 months, we meet these patients. So initially, we will meet them at 3 months, 6 months to see how they're going with HRT, whether the symptoms are under control, whether everything is good. And then every 12 months, we meet up really mainly to see that they haven't developed any medical conditions in this 12 months, which would necessitate change of their treatment or stopping of their treatment. Also, these 12 months visits actually tells us how they are doing with their other alternative therapies that we have discussed and said that you will need these. Because what happens with patients is, or women is, I'm feeling normal. I don't think I need anything else at this moment, and they kind of slack on the other therapies. And these 12-month reviews actually just reinforces that no, we have to do something more.
And
So,
sometimes it's worth stopping it and seeing how you go. You're not at the 5 years yet. You've only had it for 1 year, but it's worth stopping and seeing if you have any symptoms and how bad they are and whether you can actually cope with them. So that is also an option. It doesn't have to be that you stay and then you come off and that's it. You're never going back on it again. And even at 5 years, yes, the recommendation is 5 years, but for some women, it might be that they really find that 5 years isn't enough for them. And so we can carry on for longer. But it's important to understand that 5 years is probably, once we get to 5 years, we need to be more careful if we're continuing.
okay.
Absolutely.
So the last question of tonight: what are the long-term effects of menopause, and how should women look after themselves after menopause?
I'll start with the one that is important to me, and that is losing your bones, as in your bones becoming brittle. That is really, really important because estrogen is very important for bone health. And once we lose estrogen, we then start to lose our bones. Basically, our bones become more brittle. And as we get older, we are more likely to have fractures. Things that would not have caused a fracture when we were younger will cause fractures as we get older. And so bone health is really important. My top message to people who are listening, who are very far away from menopause right now, is that you will determine your long term bone health by what you do now in your younger years. So I think, we talk about menopause and we usually target all of our information to women who are either almost there or already there. But there is a very important message to give young women and young girls, that this is the time to make your bones stronger. And by that, I don't mean drink 10 liters of milk a day. What I mean is that it is important for you to have regular exercise, especially weight bearing exercise, which increases your bone strength. Because the bone strength that you have now will be what will last you in the long term. And you can't build that bone strength when you get to 50. By that time, there is no
It's too
building, there
late.
is only downhill. And
Yep.
so start now so that you come to 50 with good, healthy, strong bones.
Latika?
Um, I completely agree with Nisha, and that is the topmost problem with menopause, especially in women. The other things that we talk about is, yes, the risk of heart attacks and stroke. Not much that we can do to prevent that in terms of medications, but a healthy lifestyle definitely helps. In terms of the other long-term health issues, which again we can do in our younger age, is pelvic floor exercises. Because as we grow older, or we mature like good wine, our not bones, yes, get weaker, but so do ligaments. So if we are regular and religious with our pelvic floor exercises, we can prevent, problems with incontinence in our later life. So that actually helps a lot as well.
Thank you. Before I let you go, one of the things that you talked about is a good, healthy diet. We don't know what good, healthy diet is. Everything is fried. All I see photos of today, I've had parantha with chai, and I'm like, how are you doing it? So, what is a good, healthy life? I mean, where is the moderation? Obviously, in saying that, I had puris for dinner tonight. One of my friends, she dropped it at the nature strip, and I went and picked it up. But I don't do it on a regular basis. So, what is moderation?
So, my top tip or my kind of philosophy is very much the philosophy of Rujuta Divekar, who is a dietitian based in India. And she will often say that, eating something that you enjoy eating, whether that be a puri, whether that be a jalebi, whatever it is, enjoy it and eat it. Don't be hard on yourself. Don't cut out the things that give you joy. But at the same time, if you are eating McDonald's every second day, then that is definitely not healthy. So eating things that you enjoy is great. Do it in, small bits and enjoy it when you're doing it. Don't guilt yourself over it. But your regular diet should be what you would eat, not McDonald's. And the other thing is, eat what your grandmothers used to eat.
Yeah.
They ate home cooked healthy food. If we all eat what our grandmothers ate, we'll be absolutely fine.
Thank you. My sister-in-law said she's actually started having roti sabzi for breakfast before going to work. And she's like, I've ditched everything. I make, her help makes poha, makes upma. And she said, I'm so much better and fitter. So,
And
and
I agree that, we have busy lives. We don't have the time that our grandmothers had to make this, home cooked meal. But we can do the same thing easily. We can make our own easy variations to what our grandmothers ate.
okay. Thank you so much for tonight. As always, Latika and Nisha, I
It
cannot
was a
thank you
pleasure.
enough. Um, and I'm sure, Nisha, I will see you soon. Thank
Yes.
you to everyone who have watched, and I hope this has been helpful. Good night. Stay safe. Please get vaccinated. Please
Yes,
get
please.
vaccinated. Okay, good night,